Hello, this is Childfree diANe, and boy, I've got a real humdinger of a talk today. It was a magazine article, and boy, it's definitely one of the very best. But yeah, we were just trimming some bushes today, and this is a bird's nest from the past year, and it's kind of wet. It's kind of like, ragged by now. But it's really kind of cool because it's still held up, and it's very firm, although it got really wet, saturated with the rain. But, one thing about wildlife and the animal kingdom is that they cannot prevent their births. So, when somebody calls animals dumb, I don't buy that. I believe that humanity is dumb, and this particular article that I'm going to go over, it's about 2 pages long, but it will show you how absolutely dumb and stupid humanity is. A group of humans with great resources who can prevent birth with contraceptives and who can prevent birth through abortion and through sterilization practices. So anyway, I'm just going to put this little bird's nest down right there and go on to my talk. Okay, this is the magazine Jama, the Journal of American Medical Association. So anyway, this is the article. Oh, so brace yourself, because this is, this is an example of a clueless natalist. Okay, this woman is a doctor, and she describes her newborn who is constantly crying, and her and her husband are having a very difficult time sleeping, and it's interrupting their lives. And she works in palliative care, which is, cases of medical patients who are, terminal, have very little hope for the future, and who are involved in pain management, cancer treatment, and, just basically getting through the day. And I will put a link to palliative care, I don't even know if I'm saying that right, but anyway, I will put a link down below under my description. So let me go through this article. I remember sitting next to my husband on our well-worn gray couch, the kind that matches everything and is ideally suited for the lives of physician transients, moving every few years for the next phase of medical training. We were staring at a baby monitor as our sweet 9-month-old daughter, Sophia, wailed in her crib. I could see tears on her soft, plump cheeks in the grainy image, and felt my own warm tears as they slid slightly down my face. It was our first attempt at crying it out. Months of sleepless nights had created a desperate yearning for rest that penetrated my every moment of wakefulness. In addition to being a new mom, I was a new palliative care fellow, trying to learn clinical skills that required a level of focus that seemed unattainable in my sleep-deprived fog. My hospitalist husband and I had pored over countless baby sleep books in an effort to regain our sanity and humanity. We tried swaddling, unswaddling, nursing to sleep, not nursing to sleep, bouncing on a yoga ball, a magic marshmallow sleep suit, and a litany of other tricks that failed to keep our daughter's angelic eyelids closed for any meaningful period of time. We resorted to crying it out from sheer desperation after I nearly collided with a biker while dozing off on my way to work. Okay, yeah, that's the first real disappointment. I almost just, you know, threw this magazine down in utter frustration and, you know, cluelessness for this poor woman, because she is a physician working with the most desperate and tragic cases of humanity. Yet she brings forth a child into the world. Her and her husband did not learn their lessons in medical school and residency, and now she's a fellow, and she's going through some suffering and some challenges with her own infant. Now, I never bought into any kind of magical, you know, Pollyanna fantasies of natalism. I mean, I see it as nothing but pain and energy exerted and frustration and disappointments. So I never bought into the fallacies, the fantasies, the imagery, the romanticizing of parenthood and motherhood. I saw it for really what it really was, and even though I've never experienced it, everything I've ever believed about it is written about, is talked about. There's regretful mothers, there's regretful parents, there's regretful fathers. And I mean, I just want to say, you know, I told you so. And like, how could you not see it otherwise? How could you not see anything but frustration or disappointment? But anyway, some people do buy into the myths of parenthood. Oh, this just really, this made me just gag on my own tongue. I suddenly understood my sleep training aversion. Constantly confronting profound suffering in the lives of others made me intolerant of any suffering for my daughter. And she and her husband are the cause of that suffering. They brought forth her life. They conceived that child and was allowed to be brought into existence. And they knew far ahead of the time that she was born that she would suffer, and that people suffer, and that babies get sick and children die. Despite reading studies showing no adverse effects of sleep training through crying it out, and reassurance from many friends who have done it themselves, I was incredibly distraught when my own baby was crying in her crib. Now, I want to make a point there. When something happens to you and it affects you deeper than it did before it affected you, that's because it's, bugs are biting me here, that's why I'm moving. But anyway, that's because being a parent makes you extremely selfish. It makes you more self-absorbed and egotistical. So by seeing your baby cry, that's just an extension of you, and that's an extension of your feelings. And if only that made you empathetic, then you were never a selfless person to begin with. You were never an empath to begin with. It really saddens me to hear that, because it seems as though she only became aware once she had her own child. And then she just talks about the sleep training, and she bought a bed, and she began to co-sleep with the child in order so her and her husband can get some rest. The extra strain on our marriage by the invasion of our singular remaining adult space, which was their bed, was balanced by slightly more rest, and the proclamation we both knew to be false, that this would be a temporary arrangement. And then her friends criticized her for being a sleeping new parent. True to form, I had struggled to adapt to the constant change and loss of control of new parenthood. But my reaction to sleep training felt different and outside the norms of my peer group. A psychologist was asking for assistance with the case of a young patient with an aggressive cancer who had experienced a difficult childhood and a long history of depression and was foregoing curative treatment. The case was not out of the ordinary for this meeting, so I was surprised to find myself holding back tears as I listened. I felt nauseated just imagining this patient as a small child enduring horrific emotional abuse. The bad luck of a cancer diagnosis seemed particularly harsh after being subject to unnecessary cruelty. That mental image of an unkind childhood was followed by another of me cradling my daughter in the middle of the night, enveloping her in warmth and affection as we rocked with her head on my shoulder. Now that kind of really reminds me of the recent backlash that Ivanka Trump, Ivanka, yes, the daughter, suffered when she was shown with a photograph holding her son when there was, previous discussion of children in other countries, immigrants, I believe, being lost in the system, or they were killed. Hey, girl. So that does remind me of the Ivanka Trump story. Everybody is selfish and everybody cares about their own more than they do others. So parenthood, motherhood does not make you caring. It does not make you an empath or a highly sensitive person, HSP. It makes you selfish. And the fact that you are more concentrated on your own children's suffering means that you made a grave mistake in creating them and bringing them into existence. And it also makes you very incompassionate. So I suddenly understood my sleep training aversion, constantly confronting profound suffering in the lives of others, made me intolerant of any suffering for my daughter. As a palliative care physician, I was surrounded by extreme distress, physical, psychological, spiritual, and existential. Hearing the story of this patient prompted a flood of images of patients I had seen earlier in the week. A cachectic, jaundiced, previously healthy man diagnosed with metastatic colon cancer who would probably not survive to leave the hospital. A young mother who refused analgesics for her severe pain for fear of addiction, despite her prognosis of only a few weeks. A man who was diagnosed with metastatic cancer after developing sudden pain while bringing his wife to the hospital for the birth of their child. And then she says, to be clear, I love my job, blah, blah, blah. I derive meaning and satisfaction from helping to guide patients through life-threatening illness, blah, blah, blah. And yet, all that reflection and processing does not make the grief go away. My excessive coddling as a parent had little to do with any parenting philosophy. Rather, it was rooted in a need to avoid witnessing any additional anguish after leaving work. I could not allow my child a single moment of avoidable distress after a day filled with so much unavoidable tragedy. Well, lady, physician, fellow, stupid mom, new mom, life is avoidable. tragedy is avoidable. The fact that you have not addressed antinatalism in your blurb really sickens me. It shows that you were so far away from being enlightened and well-educated and intelligent. The cumulative weight of the despair and discomfort present in the hospital sometimes give me the sinking feeling that suffering is the predominant state in life. Whoa. Now this is heavy. This is a real humdinger, isn't it? While I know these patients are particularly sad exceptions to the norm, the skewed balance of tragedy to happy endings often interferes with that rational perspective. I want Sophia to believe that the world is fundamentally a good and happy place. Okay. Well, that's a Pollyanna statement there. I carry a deep-seated fear that even a small amount of discomfort will lead her to conclude otherwise. So I let her pull my hair and scratch my face while nursing as she pleases, rather than set ground rules that might lead to a few minutes of whining. I carry her everywhere instead of making her sit in the stroller she dislikes, because I cannot give that young patient with colon cancer a little more time or convince that woman in pain to accept the relief medication would provide her. Well, you know, her child has already suffered. Even as a child or an infant, the mother cannot prevent its gas pains, its hunger pains, its thirst pains, its pains of crying, its loneliness, its frustration, possible falls. So the fact that the mom is carrying the baby and sleeping with her and letting her do as she pleases when she nurses is no comfort to that child. That child is already suffering. It suffered from the moment that it was born. Okay, baby. So she also says, I know I can't make her life easier, and constantly indulging Sophia will not help her develop into the independent person I hope she will one day become. Well, now, at least this is a spark of accountability in this woman. So, yeah, she tore my page here, but anyway, so this woman is, it's just pissing me off the longer I read this stupid article of this stupid person. But yeah, I know I can't make her life easy forever. And that's the golden statement right there. Isn't it, girl? Isn't it, huh? Hey there. Hey there. Hey, girl. Okay, so I'm going to wrap up this article. She goes on to a little Pollyanna blurb. Blah, blah, blah. Oh boy. She stopped obsessing about her daughter, that she would learn to sleep through the night. She stopped checking the clock on her phone. I stopped feeling ashamed about the bed sharing, blah, blah, blah. And then she says over here, I am a more compassionate and forgiving physician because of my experience as a mother. I am a more present and affectionate parent because of the constant reminder at work that time is often shorter than we think. Oh, so here's my comment. Here's my little reply to that statement of hers. She is less of an empath and far less compassionate by bringing a child into the world than if she remained child-free. And this is something that Pollyanna natalists do all the time. They brag about their motherhood or their fatherhood making them a better person or a better volunteer or a better worker. Absolutely not. If you weren't awakened from suffering before you had children, then you never had the possibility of being enlightened. You're just slow. You're clueless. An antinatalist, an ephalist, they are awakened and enlightened and truly educated before damage is done. And this mother, and probably the father, only realize certain things after their child or their children were born, which is far too late. The damage has been done. There's tremendous suffering in this world, and her own daughter, this Sophia, will indeed be a victim of many sufferings in her lives, and she will be someone's patient someday. And she will die without her parents present, and she will be buried by, or she will, you know, perish someday, just like everybody else. She will age. She will catch disease. She will be grief-stricken from the loss of her parents. She will be frustrated with school and with partners and with life and with traffic and careers and with other people and bosses. So, yeah, the last thing that this woman says was, those strengths come with weaknesses, like being an overprotective mother. My styles of parenting and doctoring are different from what I would have imagined before inhabiting these roles. The adaptations I have made along the way are not good, bad, or otherwise. They are simply the tactics that allow me to integrate the many versions of my evolving self. Oh, evolving. Maybe she will evolve to someday write an antinatalist article. Maybe, huh? So thanks for putting up with me this far on this tragic article. I mean, I don't even know what to title this because it is just so mind-blowingly ignorant, and it just shows how clueless people are. And you know, I'm at the point where I think professionals, like medical professionals, physicians, nurses, technicians, are absolutely the most brain dead, the most unenlightened, the most clueless and stupid of all. So, it's not the animal kingdom that is dumb. Little bird. Is it? No, it's not the animal kingdom that is dumb. It is humanity that is dumb. Thank you for watching, and please subscribe to my channel if you already haven't.